Hi, I'm Dr. Faranak Kamangar, and welcome to the Future of Dermatology podcast. We're here to talk about the real science behind skin, the medical breakthroughs, the cosmetic innovations, and everything in between. Today's episode is one you do not want to miss. We're tackling perhaps the most consequential question facing our specialty right now. Is AI going to replace us, or is it going to enhance the dermatologist? And we know AI is a revolutionary way to enhance our practices while it saves us time. But again, is it going to replace us entirely? I personally don't think it will, but today I'll be discussing this with someone who thinks it might, and I'm not debating this with just anyone. I'm joined by a true legend in our field. Before I tell you who it is, let me read their bio and you can see if you can guess. I'm going to emphasize some of the clues. Our guest is an academic medical dermatologist and editor of 3 dermatology journals. He has very broad interests and has published over 1,500 Medline referenced articles along with his colleagues. His research encompasses use of AI, including to measure facial skin characteristics and to make dermatologic diagnoses. He hopes to use AI to help improve patients' adherence to treatment. Our guest also uses AI regularly to track down information and to make his writing better. And he states, even including for writing this bio, he doesn't think of himself as an expert in AI. He just finds it already is a very useful tool. His background is particularly relevant to how AI may affect dermatology, as he has studied many aspects of delivery of medical, surgical, and cosmetic dermatologic healthcare, and has been consistently rated by expertscape.com as the #1 expert in the world of specialty of dermatology. A professor of dermatology, pathology, social science, and health policy at Wake Forest University School of Medicine, it's my pleasure to welcome Dr. Stephen Feldman. Welcome, Steve.
Sarah, and that introduction couldn't have been better if I'd written it myself.
There were some hints in there. There was the adherence to treatment. I'm sure by the time we got to the end, most knew who we were talking about. We're so happy to have you here today. I am so looking forward to this friendly debate. We chatted about this, about how I, of course, am on the side of, I am drinking the AI Kool-Aid. I think it's going to be the savior of all of our problems and fix a lot of the problems I've been thinking about for the past decade or so within medicine. And, we chatted, you felt that the technology is at a place where it could maybe even just replace us. So I'd love to get your thoughts.
Yeah, I look forward to talking to an AI expert like you on this very topic. I just think of my iPhone, it's sitting here next to me. This thing sees things I cannot see. I mean, it can see wavelengths of light that no human can see. I mean, I've got, at my age, probably some little cataracts or something, but this thing, just wipe the lenses off and it's good to go. And then its memory. I mean, at my age, my memory is not so great. This thing's memory is infallible. And then the question comes, well, dermatologists have so much training. Yeah. So, I could maybe see, 200,000 patients over the course of a lifetime and maybe, see that many pictures of things. You can give that much information to my iPhone before breakfast. What advantage do I offer over this guy, in the long run? I just don't see it.
Oh, I love it. Such a good point. It was maybe about a couple of months ago, I was at UC Davis, the School of Medicine, giving lecture to the med students on AI. And I had this realization that when I was there as a med student, that's when the first iPhones were coming out. And I was like, how different is their training to ours? And how do we even, because what I know is how I learned medicine, and I'm trying to teach that way to them. But this is a different world. They're like cyborg med students now. They're going to be trained half AI, mostly iPhone, or even just down to what I visualize as full body photography is still the giant cameras from the companies. And a lot of what's coming out now is new contraptions where everyone's just sticking iPhones on them. And the capability of the phone camera is better than even some of those, our most advanced, like the photography machines. So it's true. I mean, I think our brains have to, especially for us who weren't necessarily trained in the AI and all of that, while we obtained our medical training, our brains have to shift a bit of where does all of this fit now?
Yeah. So when I was in medical school, we used this book, Goodman and Gilman, for our pharmacology class. Told you everything you could want to know about drugs. And it was this massive textbook, and the pages had to be really thin to encompass all the information. Now there would be probably 10 times as much information available. And when I speak to young people about it, it's not that they don't know what Goodman and Gilman is. I'm not sure they know what books are.
It's so true. It's so true. Everything is digital now. I mean, every lectures are all recorded. All the meetings and their lectures just go straight from video, audio to text converted. So everything is just different modalities than what we've been used to. So I think that the whole new world is going to look different. As far as if we'll be replaced, though, I personally I feel like we as the physician we won't be replaced, but what we're going to be doing, I think, is going to be changed drastically. And again, I'm not sure if our medical education is keeping up with how quickly that change is going to be made. I don't see a whole lot of lectures yet within the dermatology training or the medical school training of, well, in 4 to 5 years, this is what you're going to have to do. Whereas like with the EHRs, we were, and as they rolled out, the medical students were also on the EHR, the residents were also on the EHR. So they were kind of getting trained along for it. But I do feel like the AI is going to just, once they're out in practice, it's going to be this thing that just hits them.
Yeah, for as long as people are using doctors, AI is a huge help. But do we need a dermatologist to tell the patient you have acne, you need to use a topical retinoid, maybe an antibiotic, these are your options? If the government said, we're going to let AIs prescribe drugs, then I don't know what the dermatologist is really needed for, because it sees better than I do. It remembers stuff better than I do. It's up to date on all of the information. And then there's the issue of people wanting an empathetic, caring doctor. And I think it's been proven that AI is more empathetic than a human. If you ask, ChatGPT or doctors to respond to some patients' questions, the responses from the ChatGPT are more empathetic than the doctor's responses. And that's probably at a good day, at 4:30 in the afternoon when you're just tired. God, how empathetic can you really be? And the AI, it doesn't care what time of day it is. I think judges, their judgment varies depending on whether it's almost lunchtime or not. AI, it's going to be consistently good judgment all day long.
That's true, actually, because it's teasing out what parts of the doctor can it actually replace. And you're right. I think empathy is like something that people might think of right away, but we're going to lose 100% because it's created. And I think it's actually interesting. I think the reason AI is doing so well, it's actually going to be also its downfall of why it won't ultimately replace us. It's really empathetic. The companies have made AI just really nice because you want really ultimately for the business, for the person to keep chatting, keep asking questions. The AI asks another prompting question and you want that chat to get longer and longer. And you want it to be this really pleasant exchange where good answers are coming back and like nice words and all of this. So they're designed that way basically. But because of that, actually, because of their needing to be right and giving an answer, I think that's actually the downfall versus a physician, even though I wouldn't say mean is probably not the right word. It's more tired, we do kind of get, but we are a little bit more skeptical. We feel comfortable in ambiguity. I think we have a comfort with telling a patient, could be this, but let's try this and see you in 2 weeks. That would break down an AI. Like an AI cannot be that uncertain. It needs to tell you, you have this right now, and I know how to treat this, and it needs to be this and this and this, and here's your 3 prescriptions to, treat that. So I actually kind of feel like the limitations that it has is because of it's over empathetic. I think that's one of its downsides. One of the things we saw with Derm GPT initially was that we didn't want it to be that nice. We wanted it to kind of be pretty skeptical. We wanted to not say that it has an answer if it didn't. So we don't want it to hallucinate and make up an answer. And then there were times where it just wouldn't answer anything. And then we thought, well, that's not really good engagement either. So you need some balance. You can't just be like, no, all the time either. But you can't really just be super nice all the time. Like ChatGPT, Claude, and all these other really smart. The knowledge is there. They're incredibly intelligent. But I think in medicine, it's not a math problem. It's not something you punch into a calculator. There's all these multimodal factors that come into it. So I think there are still situations where we might be safe, just actually because of our little bit of ability to be skeptical.
No, I don't think so. I certainly agree with what you're saying because, my AI, I use Claude mostly. And
I do too. Actually, I love Claude.
Yeah. When I told Claude, my buddy Claude, that I had this opportunity to speak with you about this topic, Claude was immediately saying, well, Steve, there's no way you will be replaced because Claude wants
It has to. Yeah, of course. It's going to lie to us as it's replacing us.
Replace me. So it took, I had to convince Claude, and Claude's giving me all these arguments for why dermatologists are, will survive, as a specialty. And I'm like, it's like, well, but you want the safety, of a dermatologist. You want to make sure that they're checking on things. I'm like, Claude, have you ever heard of Waymo? I mean, what is more complicated safety-wise, navigating the streets of San Francisco or being a dermatologist? I'm pretty sure navigating the streets of San Francisco is more difficult. And yet Waymo, I think, compared to human drivers, it's like reduced pedestrian injuries by like between 80 and 90%. I mean, so I'm pretty sure now you might go, well, people are social beings. They want this interaction. But then I read about AI generated deep fakes, of politicians that you can't distinguish. Right now, Farah, you don't know whether you're talking to me,
right,
or it's a fake of it. You can't tell anymore. I am so interested in getting people to take their medicines. And one of the things I think we need to do is have visits with people, and like piano lessons. If a piano teacher said, here's your medicine, see you in 3 months, nobody would practice the piano until 3 days before the recital. Our patients don't take the medicine because we're just, in the research studies, they bring patients back at weeks 1, 2, 4, 6, 8, 12, makes people use the medicine. I don't know any dermatologist who's going to bring the patient back at weeks 1, 2, 4, 6, 8, 12 for a clinic patient, Hey, but my avatar could do it.
Absolutely. And I think you touch on such great points. First, I shall go back to the Waymo. I think the Waymo is a great use case because that is good technology, at its best. And everyone said that autonomous cars are going to take over by 2020. So that was the prediction, right? And then all the taxi drivers were like, but they don't know this. It doesn't know the streets. Like I know the streets and I know the personal touch and all this. And it was very obvious, even with like the Ubers and things, that the original taxi driver feel of the streets and things was useless. That's gone. Knowledge-wise, technology and maps will beat the taxi driver who's been doing this for 50 years any day. Same as us. Knowledge-wise, AI has access to all the knowledge in the world, all the textbooks, all the journals. So we're not going to win out on those things. But in the end, we still have our normal cars. Mostly, you see a few Waymos around, and they're really fun, and they are picking up. But they didn't replace all cars by 2020. They might still. It's not like a gone. They might at some point. But I think the main thing is that it's the adoption of technology is still much slower than we think. And there are still, of course, a lot of legal things in play too. So I think especially for the corporate practice of medicine, I think it's still going to be a while before AI can take on all the risks because they still need someone to sue if something goes down. So you do need that liability piece. These things can be worked out over time, but there's just some of those logistical reasons. But when you touch about adherence and augmenting the dermatology visit, I think that's where the real money is for me. I think it can make us so much better. I think innately it's going to get rid of some of our routine things. So we are going to have to go up one layer, a little bit more complex. Like you said, maybe just a regular acne refill. Does a person have to wait 6 months and see a dermatologist just to get their retin-A? I would say the direct-to-consumer telehealth platforms have filled a lot of that space too. That's not, so that they've been around for a long time now, but people still come and see us. So access is, of course, a main measure, but I think there are other routes of access, and we still remain, still hot. They didn't fully replace us. So there are these kind of other models that have addressed these things. But I think the augmenting us to do our jobs better. Other fields have remote patient monitoring where they have nurses and everyone go out to homes and check blood pressure, things like that. We don't do that as much because it's that's way too much. That's overkill to send someone to make sure they're using their acne meds. But if our avatar can check in with them, that's huge. And that's a lot of these adherence in these direct-to-consumer telehealth models is really high. That's because they want the adherence. They're not like our office. They want the person to stay on their compound medicine all year. So they keep checking in and they have all these virtual, check-ins, and adherence is really great with these businesses that do it differently than we do. So I think that's a great way to kind of augment our practices without increasing a lot of overhead of hiring 3 more nurses to call people and say, are you using your medicine or not? I think it'll give us a chance to go more complex. I really think it's a chance for us to go a little bit more complex with what we do rather than, lots of the recurrent visits that we do that might not need to happen with the derm at that frequency. And then I think the biggest win with AI is going to be decreasing our administrative overhead, because I think, not even think, it's already happening. There are individuals being replaced in healthcare, but it's not us just yet. It's not the MD category, except for maybe radiology. I can't speak to those guys. Don't go into radiology. But the main thing with radiologists is that for decades, they've been collecting their data in the perfect AI format. They have digitized all the images and they've annotated all the images. I mean, they were set up, they're ripe for replacement, whereas it's still going to take a really, really long time to actually build the infrastructure to replace dermatology information, just getting databases of images correctly annotated and having it to a level that it can actually perform, the way we do.
It could take a really long time. 6 months.
Maybe 6 months, maybe 9.
I mean, it could take a long, long time before, somebody collects a bunch of images and annotates them. I guess for me, at my age, that's a long time. But anybody got a bucket horizon in about a year or two, I don't know. I'm trying to figure out.
It's not looking good.
Where does the dermatologist have an advantage? Is it in the more complex patients? I mean, the more complex you get, isn't it the value of better sight, better memory, more data, more valuable as you increase the complexity? I mean, when dermatologists are asking GPTs questions, are they asking questions about the basic stuff, or are they trying to get help with the complex things? I guess they're
actually, that's a great point. So how are patients interfacing with GPTs and how are doctors interfacing with GPTs? And like for us, a derm GPT, we see obviously a lot of complex cases. The second consult agent is used a lot. Okay, I have this, like you would talk to a colleague. I have this case, it's this and this, what would you do next? A lot of the mundane things, prior auth, letter, patient handout on even tretinoin, the little wins that take 10 seconds with AI to do, change the handout to a language that a person understands, or for a child, change it to a cartoon character they like. For adherence, I mean, these are really like easy wins with AI. And then there's, and it's pretty efficient and helpful. But then there's studies showing when patients or public ask questions from a GPT, it gets it wrong a lot because the patients don't know what to ask. So the context matters a lot of the query. AI is just going based on words. It doesn't have any historical, it's not multimodal, it's not looking at the situation, it doesn't have all the inference points, it's just going off the prompt that the patient is asking. So if they ask it incorrectly, it's going to go down a whole other line, whereas the physician's asking questions pretty well. Like they're in the right category. They're just sort of like, could it be this or could it be that? Or if the AI gives a wrong answer, they're like, no, I think it's more this. Let's go this way. Whereas a patient could really go down a loophole and go to the wrong. And there was something just actually public. It was in one of the New York Times articles came out with this a report on this article about wrong answers from patients. So I think we do add that higher level of contextual expertise. But even for the dermatologists, I do a lot of courses and webinars and things on how dermatologists should prompt too. Because if even the dermatologist has the contextual information, but you're not prompting the AI correctly, you're still not going to get the right output or get some hallucinations. So even with that expert skill set, even if you're not prompting the system correctly, which is where the agents come in. We've kind of built agents to like pick up where the doc is not asking things correctly. Or mostly it's not because they don't know how to prompt, it's because they're busy, they're in clinic and they're just saying 2 words, acne, retin-A, tell me more, like versus writing out the whole thing. Whereas the patient query or prompt could take it completely a different way. So I think those are definitely some issues of direct to consumer AI. So where there's like no doctor involved. Still not convinced.
Yeah, not at all. Because I think you're absolutely right that the doctor has this contextual information when they're asking the GPT a question and they're asking AI a question. Where did they get that contextual information? Well, they've already talked to the patient. So if the AI talks to the patient and can ask all the right questions and won't forget any of the questions like a doctor might, because they're, it's almost lunchtime, the AI will have that same contextual information. I'm not sure where the doctor has any information that the AI wouldn't have as well.
So that, I think, then we're getting into the category of agentic AI. So there is just the regular GPT where it's language-based. I have a thought, it gives me sort of a thought in language to language. Then you can go into agentic world where the AI is now doing stuff. So it can, based on your question, say, I think this is a person talking about something about skin. Maybe I need the dermatology agent. Pull Dr. Dermatology out. What questions should I ask so that I can prompt correctly? And in theory, all of that is good, but I think it's important to also understand just the limitations of the technology. That's not as easy to do, to replicate a multimodal being like us. I know that you have the imagery, you can have the agent ask questions, and it seems like it should be able to do all of the right things. And it can in many situations, but I still think we have a little bit of an advantage for a while. Maybe more than 9 months or so before a totally autonomous medical agent can do what we do, basically. And then a lot of the issues is the ambiguity. I think we have a comfortability with ambiguity that AI doesn't have. And that seems because AI is very good at knowledge. It has a lot of knowledge, obviously has access to everything, but it just doesn't quite have that level of comfort with holding 3 hypotheses in their head at the same time in a way that we can. It really is, and you'll see in ChatGPT, a patient might say, I have a bump here, what could it be? And it'll give you a differential diagnosis. It might even go further and give you probabilities, like it's maybe 60% this, 40% this. But for an agentic workflow to hold 4 differentials at the same time and ask you accordingly to get to the right point, I think our brains can still do that a little better, but just a little bit, for a little bit longer. It's a harder task. It's a harder task.
Yeah, it sounds like you agree. We're going to get replaced. It's just going to take more than a year.
Maybe 18 months.
There you go.
I think we have a little longer.
I just envision a world where somebody gets a boil in their groin, and instead of not going to the doctor because they don't want to show their genitals to another human,
True.
They take a picture and they show it to their AI, and the AI goes, "Is this your first one or your second one? You've had 2 there? Oh my, this is early HS. You need this." And patients with HS will get treated earlier, dramatically earlier than, they are. In other words, the human interaction can actually be a hurdle to successful care.
That I 100% agree with. I mean, there's the perfect world of you see the dermatologist later today because you woke up with something today, but that doesn't happen. Access to us is hard. there are access deserts across the US and the globe. So there's the perfect system, of how things work. Then there's just access. So whether the AI is perfect or not, if it gets you better access and closer to treatment, I think AI is going to offer a lot of solutions. I think in those ways, it's really great. And I think it's going to do a lot of good things for public health in general. As far as within the dermatology clinic, I think it has a lot of ability to help us, because I do think we've lost a lot of autonomy as physicians over years, just because the different systems have evolved, so technology has taken over. But we're pretty small. We're less than 2% of the House of Medicine, so technology is not made for us. They're made with primary care models and different, formats. So, and I think AI is going to be the same. AI will be made, and a lot of the scribes are coming out with a format of, how do you do a clinical note for primary care? And then the dermatologists are having to use the AI scribes and kind of form them a little bit more towards what's helpful for them. So I think, AI is coming in the clinic kind of for the helping the doctor, the augmenting the doctor. So I think that's a really important part to be involved with, more so than even kind of worrying about it completely taking us over. I think what I'm worried about most is AI, us not being replaced. We're still there. We're given bad technology. There's even more barriers to us doing what we do. Administration is decreasing. That's just something that's happening. I know we've seen that chart of there's been a little bit of growth of MDs over time, but then this huge growth of administration to deal with the technology hurdles and revenue cycle management and all the things. So those pieces, some of them are very automated and are easy to replace. So those parts are being replaced, like a lot of billing and different things that we interact with. So parts of healthcare are for sure being replaced. But I think we're a tiny sliver of the healthcare cost. We're actually also pretty inexpensive now, because the way reimbursements have gone down and down. There's no great economic advantage to replacing us. I think that's another thing that, like it or not, is probably going to be, we're not a huge target of, replace these guys. That's where all the money's going in the healthcare field, because there would have to be a lot of legislative overhaul for malpractice laws and things like that to remove us from the equation. So I think we're just focusing on how AI could help us is still a good target for the 18 months we have left.
Yeah, in the short run, yes. But in the long run, let me just close by saying, I don't think we need to worry that AI is going to replace us. It is going to replace us, but we don't need to worry about that. I mean, when cars replaced horses and buggies, the world became a better place. And I don't know what we're going to be doing. It'll be different from what we're doing now. But if you want to know what we're doing, I suggest signing up for Claude and asking Claude, because Claude knows everything.
Claude knows what we're doing. And then now there's GPT Health, which you can really upload your entire medical records into, which I think is crazy, because we've had so many trainings on never share HIPAA, PIA, and PHI, and now patients are just directly putting their own charts into the AI system. So it is changing drastically. But I love this conversation. I think we should almost have this every year or two, just to see, like in 18 months, we should have this conversation again and see if the predictions came true. And related to that, we always ask at the end of the podcast, anything that you're very excited about for the future of dermatology, AI related or not.
Yeah, my main clinical interest is in psoriasis management. We've had so many advances so far. I can't get excited about any other advances in psoriasis management, except for oral interleukin 23. Oh my God.
Yes.
Could anything be better than that? Wow.
That is really exciting. Actually, that is incredible. I mean, just to have an oral biologic option. And I think that's another thing too. There's so much just coming out in the inflammatory skin disease space that a lot of primary care or primary medical germs can't keep up with. So I think the education piece is also important as well. So, well, thank you so much, Dr. Feldman. Thank you so much for taking your time. We know you have a million things to do and you are so busy. So we really appreciate you giving some of your time to us. We'll have to see in 12 to 18 months which predictions come true if we still have jobs or not.
Very much my pleasure. Thanks for having me.
Thank you. Thanks for joining us today on the Future of Dermatology podcast. If you enjoyed learning about the science behind skin, make sure to subscribe and we'll see you next time. As a reminder, this podcast is for educational purposes only, not for medical advice. Always consult your healthcare provider.